As a radiation oncologist that treats breast cancer, we work using a multidisciplinary technique. The doctors that are included on the team include a surgeon, a medical oncologist, a radiologist, a pathologist, and a physiatrist, among others. Radiation therapy is used in a number of ways after the diagnosis of breast cancer. In 2 instances, after lumpectomy, it's the standard of care to treat with radiation postoperatively to enhance your local control to be equivalent to that of a mastectomy. There also are reasons why we would use radiation after mastectomy, depending on the stage and the lymph node status. So the overall goal is to increase our local control and therefore our survival. There are many types of radiation therapy developed for breast cancer. Photon therapy is the standard of care used in most institutions. There's also proton therapy that we use in certain situations, such as retreatment, or if we want to treat total nodal irradiation, we find that the outcomes are better in terms of sparing normal tissue using that particular modality. The common side effects from breast irradiation include darkness of the skin or erythema of the skin that resolves over time. You can also have shrinkage or swelling of the breast, which usually resolves as well. Fatigue, not an overwhelming fatigue, it's more of fatigue where you feel like you have to take a nap in the day, but most of our patients work every day without any difficulty. Partial breast irradiation is a means of treating after a lumpectomy in certain patients, so you have to fit certain criteria, such as small tumors, low-grade tumors, ER-positive tumors. Patients have to be over 40 years of age, so you're treating just the tumor bed and not the entire breast. So not everyone fits that modality. The length of time of radiation therapy has changed tremendously over time. Initially, it was somewhere between 5 and 6 weeks of therapy. With new trials, we found that we can treat breast cancer in 3 to 4 weeks. Even now, we can treat within 5 fractions, once a week for 5 weeks, as well as intraoperative radiotherapy is one day, the same day of surgery. We, as radiation oncologists, talk in the number of days a person has to come in as the number of doses of radiation or the number of fractions. So 5 fractions means 5 doses of radiation, 5 days of coming in and getting that treatment, receiving the treatment. Here at MedStar Washington Hospital Center, we have a technique called intraoperative radiotherapy, where you can receive your radiation in 1 dose at the time of surgery and not have to come back for 4 to 6 weeks of treatment, daily radiation treatments. We encourage patients to exercise and to work throughout their treatment course. It takes their minds off of breast cancer and the situation at hand, and makes the treatment itself go quicker. So when patients ask me, how do they know if their cancer is gone after radiation therapy, I remind them that the surgeon took all disease out of their body at the time of surgery, in terms of the breast, and that radiation therapy is used just to ensure that the cancer does not return. We do mammograms annually to make sure that that remains the case throughout their lifetime.